Revisiting the relationship between sodium and blood pressure, a balanced approach. Abstract. The relationship between sodium and blood pressure has long been a topic of debate and research. While traditional guidelines have advocated for strict sodium restriction, recent studies suggest a more nuanced understanding is needed. This article explores the complexities of this relationship, challenging the traditional sodium myth and proposing a balanced approach to blood pressure management. Keywords: sodium, blood pressure, hypertension, diet, individual variability, processed food, whole foods. Introduction. For decades, sodium has been labeled as a dietary villain, contributing to high blood pressure and cardiovascular disease. This has led to widespread adoption of low-sodium diets and food labels meticulously highlighting sodium content. However, recent research has begun to unravel the complexities of this relationship, suggesting that the sodium myth may be oversimplified. Individual variability and the sodium myth. Emerging research indicates significant individual differences in how people respond to sodium intake. While some individuals experience a rise in blood pressure with higher sodium intake, others show little to no effect. This individual variability underscores the importance of personalized approaches to dietary recommendations and blood pressure management. Beyond sodium, the role of processed foods. The focus solely on sodium ignores the potential harm of other dietary components, particularly those found in processed foods. These foods are often laden with sodium, unhealthy fats, and refined carbohydrates, creating a potent combination that can significantly impact blood pressure and overall health. Recognizing the detrimental effects of processed foods as a whole is crucial in promoting cardiovascular health. Challenging the paradigm. Recent research findings. Several recent studies have challenged the traditional low-sodium paradigm. DASH sodium trial. This landmark study demonstrated that a dietary pattern rich in fruits, vegetables, and low-fat dairy products significantly reduced blood pressure, regardless of sodium intake. Framingham Offspring Study. This study observed an increased risk of hypertension in individuals with sodium intake below 2.5 grams per day, suggesting potential dangers in excessive restriction. Pure Study. This large-scale study revealed that increased sodium intake was associated with lower mortality risk in individuals with heart failure, highlighting potential benefits in specific populations. TOHP2 trial. This trial showed no association between higher sodium intake and an increased risk of cardiovascular events in patients with chronic kidney disease, further questioning the universal need for sodium restriction. These findings highlight the importance of considering individual needs, overall diet quality, and potential benefits of sodium intake beyond its association with blood pressure. A balanced approach to blood pressure management. While excessive sodium intake can be detrimental, focusing solely on sodium may detract from the bigger picture. The overall quality of our diet. A balanced approach to blood pressure management should emphasize prioritizing whole foods, choosing fresh fruits, vegetables, whole grains, lean protein, and healthy fats creates a nutrient-rich foundation for a healthy blood pressure. Limiting processed foods. Reducing consumption of processed foods high in sodium, unhealthy fats, and refined sugars significantly impacts blood pressure and overall health. Addressing underlying issues. Managing stress, maintaining a healthy weight, and engaging in regular physical activity are crucial for promoting cardiovascular health and supporting healthy blood pressure. Personalized consultation. Collaborating with healthcare professionals to develop individualized dietary recommendations and treatment plans based on personal needs and medical history is essential. Conclusion. The sodium myth is being challenged by new research highlighting the complexities of the relationship between sodium and blood pressure. Moving forward, a balanced approach that focuses on whole foods, addresses underlying health issues, and considers individual needs will be crucial for effective blood pressure management and overall health. Disclaimer: this article is for informational purposes only and does not constitute medical advice. Please consult your healthcare professional for personalized guidance on blood pressure management and dietary recommendations.